to Women Know How, a podcast hosted by Sonya
and Violet, two midlife besties who share how we make our way through new challenges and opportunities as we navigate through life's second half. In today's episode, we're going to talk about women's health and how important it is to advocate for our own health care and take full advantage of routine screenings that can make a difference in our health. We'll talk about mammograms, not only the importance of regular mammograms, but the twists and turns that can happen along the way. But before we dive into this topic, this is a reminder that neither one of us are licensed healthcare professionals or experts on this topic. We're just sharing our personal experiences and stories.
So here are some basic facts before we get started. According to the American Cancer Society, the recommendation for women of average risk, and I use that in air quotes because that's something that you need to discuss with your healthcare provider or know about yourself. Women between the ages of 40 and 44 have an optional once a year mammogram. By the time you reach 45 to 54, once a year is definitely recommended. And then at the age of 55 and older, definitely once a year or possibly every other year. Again, that's something that has to be discussed with your healthcare provider.
And mammograms are 2D or 3D. 2D being the standard. Both are X-rays, but 3D captures multiple images from different angles, creating like a layered 3D picture. And studies have found that 3D lowers the chances of being called back for a follow-up screening because they're able to see a lot more. And also studies have shown that it can be helpful in women with more dense breasts. So here in Florida, where I go, it's a standard 2D. You know, I think that if you want a 3D, you have to ask for that prescription, probably pay a little bit more out of pocket. But I guess with every insurance, things are different. But for me, I just get the standard 2D.
We talk about this often, Violet, how the standard of care may be different in different states. So for example, where I go, my radiology clinic, they offer 3D as the standard. So I've been getting 3D mammograms for years. I don't remember the last time I had a 2D. So there could be some differences between locations, individual locations, or individual states. So it's something to ask for and make sure you're aware of what your insurance will cover for you and what's available at the different locations. Beyond that, we wanted to share some personal assessment tools. So many of our listeners may have heard of these tools, but we wanted to bring them up today because they are tools that you can do yourself at home and use them as a conversation starter with your healthcare professional. So one is the Gale model, which has been widely used for a number of years. And our listeners can find it on the NIH website where you'll be asked a series of questions and then you will be given an outcome. And again, you can use that outcome to have a more robust conversation with your doctor about your particular situation. But I think it's really nice to know that you can do these assessments in the privacy of your own home. There's also a well-known assessment tool called IBIS or Tyrer-Cuzick, and that's TYRER-CUZICK, which is also another breast cancer assessment tool. You can Google it. You can also do it online. And again, I'd highly recommend if you do that and you find something that you want to discuss further or want to have a more robust conversation, you take that in and have that conversation with your healthcare professional. So those are two tools that are readily available online. Beyond that, there's also an option for genetic testing, which again, you can discuss with your healthcare provider. And I believe in some cases, depending on your risk profile, that may be something that's covered by insurance. And then of course, there is testing for the BRCA1, BRCA2 gene. Again, something you would need to go and talk to your healthcare professional about.
And these are just a few of the tools, and you can also do self-examination. But of course, one of the most important things is that we want to remind everyone to do your regular exams and go to have your annual visit with your doctor and always keep up with those annual tests, annual exams.
And the self exams. And we've talked about this, Violet, because we have daughters. And
Correct.
we talk to them about the importance of self exam. And it may feel like it's uncomfortable. I don't want to do it, but it is critically important because at the end of the day, you know your body best. So if there is something unusual, then you might know it first rather than, a doctor's exam. But, there are multiple ways to come at this. And we think they're all important to keep in the toolkit.
And especially that the mammograms are only suggested starting at 40, like you said, our daughters, they can start younger by self-examination. And that way, anybody can go to their doctor with any question if they feel anything unusual.
Yeah.
And follow up.
So we both have some stories that we wanted to share in the hopes of providing new insights and information to our listeners. But my journey with mammograms started at the ripe old age of 21 when a healthcare provider identified what was ultimately a cyst. But I had a cyst aspiration. But before that, they didn't know what it was. And, he really laid out all the options of what it could be. And some of those options were quite scary at the age of 21.
You were very young. Yeah, that's really scary.
I was a college student. And
right.
I remember specifically having a conversation with him saying, well, but I'm only 21, but I'm only 21. And, he was not budging from the fact that it could be something a lot more serious. And ultimately that set me off on my trajectory of annual mammograms. So I've had annual mammograms since the age of 21, which is mind blowing if you think of it. There may have been 1 or 2, maybe 3 years in there somewhere where my doctor said, you know what, let's skip a year. And this was during a time where I think studies were finding there were a lot more false positives. And so he was very mindful about that. But by and large, I had regular mammograms. And early on, I was exposed to this term of dense breasts. So I'm somebody with dense breasts. And as I was doing more research about it, according to the American Cancer Society, roughly 40% of women have dense breasts.
So Sonya, let me just jump in there to actually define what dense breasts are. They are breasts that have more glandular and fibrosis tissues and less fatty tissue. So when you have a mammogram, it appears white on a mammogram. And the density makes it harder to spot any abnormalities since both appear white on the screen. So usually for many cases, people with dense breasts also move on to a sonogram, an ultrasound, to be able to look deeper into the breast area because of all the white shading. A sonogram helps also look a little deeper.
And you too have dense breasts, Violet.
I do. I do, Sonya. And I'll go into my story.
I know you're going to share, but it makes me think about, because the numbers are so high of women with dense breasts, it's like you're almost like you have two potentially different trajectories. So if you're identified as somebody with dense breasts, you may have one route. And if you don't have dense breasts, you may have another route in terms of your standard of care. But just to sort of wrap up, my story, so I had biopsies over the course of my life. Unfortunately, they have never been found to be anything worrisome, but I do have clips that serve as markers that are checked regularly. So I'm very mindful of those. But interestingly enough, this is what I wanted to share with our listeners. This year, I was informed of MRIs and how women with dense breasts, like myself, would be good candidates for MRI. And I don't know if it's also coupled with my age, but this is the first time in more than 2 decades of having mammograms where I was told you should consider an MRI because you have dense breasts, not because in this moment they saw something unusual, but because it is hard to detect, as you defined. with dense breasts something that would be considered an abnormality.
I've never been suggested to have an MRI, and like I said, I also have dense breasts. So that's new information.
Yeah. And, we want to empower our listeners to advocate for the things that they may not be aware of. And so that's one of the big pieces we want to share today.
Right. So, Sonia, I started with mammograms when I was in my 40s. And not till about 5 years ago did they find like a marker. And now they follow that marker and measure. And I attach an ultrasound to every visit. My gynecologist immediately gives me the mammogram prescription and an ultrasound prescription. And I'm able to have those exams back to back. And we all know how uncomfortable mammograms could be, but you have to have them annually, and it's very important to advocate for yourself and make sure you do get those exams. This year, when I went, not too long ago, I actually had my mammogram recently, I was told to ask for a neck shield. And I never knew about this. The technician, when I asked her, I said, do you have this neck shield that I was recommended to ask for? And she said, yes, I do. Why do you need one? And I told her I have hypothyroidism, and I was told that it's best to cover my thyroid. And she said, okay, we have it right here. She took it out. It was like a lead bead sack that Velcroed around my neck. And she told me that, they have them readily available, but they only give it to people who request it. And I thought that was strange, because if they have it there, why can't everybody wear it? Like, it's just another protection. It's a shield.
Definitely.
She said they don't give it to everybody because their machines are low radiation. So basically, they don't feel you need it. But I requested it. She put it on me. And I felt so much more confident taking this exam with an extra protection. I definitely don't want, my thyroid to get affected from radiation.
Yeah.
So that was a new thing that I discovered, and I'm sharing it with you today and our audience, because once again, if you feel you want to ask for that extra item, they have it there and they will give it to you. So it made me feel great. And I was able to have my mammogram, even though, of course, it's an uncomfortable test anyway.
For sure.
But I moved on with that, and it felt good.
I learned two things from you just now, Violet. I learned about the neck guard, which is critically important, but you also gave me the idea, because I've never had this, when I get my prescription for the mammogram, to also ask for a sonogram prescription. I mean, I also need an MRI prescription, but it avoids having to come back, because I can't tell you how many times that I've gone in for a screening and then had to go back in for a sonogram, or, an ultrasound rather, not the sonogram. So, that's something that now I'm going to ask for both at the same time.
And my doctor gives me both because of the dense breast and because they want to follow the marker. It was benign, but of course, you always, anything that comes up, they continue to follow it. And it's important to have, for me, those two exams, I get them over with, and it's a great experience all at one time, instead of making 2 appointments like you have to do.
Yeah, that's annoying. And then, the other thing that's changed, and I wonder what it's like for you, early in my mammogram history, the radiologist would come in immediately after and say, okay, looks good, looks clear, need to do additional screenings. There would be like an immediate response while I'm at the radiology clinic. Now I'm waiting for a letter to come in the mail. And that's been the last couple of years. And I don't know if it's a staffing issue or what, but it's so frustrating to sit and wait for the results. And then you get the results that may say, okay, you need additional screening. And then it's another 2 weeks before you can get in. So I wonder if it's different by you in your experience.
Well, the place that I go to, and I've been going there for probably the past 5 years, and I'm so happy, because if I go during normal business hours, like not too early, they open really early and they stay open late. So I go in between because I just feel the radiologist is there. and he
Mm-hmm.
always gives me my results right away. And it makes, I leave with a full, pleasant experience that I got my 2 exams and I'm able to get my results. I don't know if it's just been the luck of the draw that I've been able to do that, or if it happens to everyone. I know my girlfriend goes to a different place and she, like you, Sonya, has to wait. And she also has had previous extra tests that have had to be done. So she's always a nervous wreck for a couple of days until she gets her results. And she always tells me, oh, I should switch to your place because they give you the results right away. And I'm like, I
Yeah.
don't know if it's just that I'm lucky in, for choosing that place or if it's all around across the board.
Yeah, I mean, I think they're trying to consolidate potentially efforts where it's like one radiologist for like 5 clinics
Oh,
potentially. And I think that may be part of it as well. But
right.
it's frustrating, but it is part of the process. And you'll have to, just take part of the process and push for as much healthcare as we need and know what's available for women. Make sure we ask for what we want, because if we don't ask, we won't get.
And advocate for yourself with your doctor. Like, I get my mammogram and sonogram. Maybe, like you said, Sonia, you should request that from your doctor. And
Oh, I will. I will.
I think all women that have dense breasts can request that, or speak to your doctor and see if you're able. Insurance is always an issue nowadays, and you have to find out if it's covered. So maybe that's the reason they give it to you separately. But I've been fortunate, and every woman should ask those questions to their doctor. Find out what exams you can have so that you can get all these tests that you need, mammogram, sonogram, and ask about an MRI if that's the case. If that's the case for you, if you have dense breasts, there are more tests, and really, you should always ask questions. Read up on mammograms and stuff before you go to the doctor, so that you have conversation with your doctor and are able to advocate for yourself.
And a lot of times, you can try to use these personal assessment tools as the conversation starter, as we talked about before. If you don't feel that your doctor is seeing you or hearing you, maybe you come in with the assessment tool, which of course they can also administer the assessment tool in the office. So that's another thing you can ask for from your healthcare provider. And I think the other thing that's really important to share, Violet, is if you feel your doctor doesn't see you or hear you or take your matters seriously, which I know we're going to have future episodes where we talk about this, pick another provider.
True.
Don't feel like you have to stay with a provider who's not addressing your concerns adequately. I'm a big believer in that. I'm a big believer in advocating for yourself for any kind of health care. Certainly, if you're ever hospitalized, every patient needs an advocate. So that's something to consider. You are not stuck with any one professional if you're not comfortable with him or her and they're not addressing your needs.
Correct. And also, Sonia, we have daughters. It's good for us to speak to our daughters about mammograms because they can do self examinations. And we all know that early detection to anything is key. So, we can't have a mammogram till we're 40 on the normal standard. But if somebody feels something and they express it to their doctor, they can move forward with all the exams they need.
Yeah, absolutely. And, I don't know what the likelihood is that they would have dense breasts if their mothers do, but that's something that they can also look into. And that way they're better equipped to know what their trajectory for standard of care should be. So that's another conversation that we will be having, should have started to have with our daughters.
Absolutely. I'm going to start talking to them about it today.
Yeah. And I know that October is Breast Cancer Awareness Month, and we're wearing our pink today. And although it's not October, it's always Breast Cancer Awareness Month for women and, and for men as well. We need to elevate the conversation. We need to bring it forward. And so because of that, we wanted to really have this show today. And we thought about, what could we bring that's new and different? And hopefully our listeners have heard a nugget here or two that could help them in their journey of mammograms and sharing information with friends and getting the word out there. So that's our hope for today.
Very important to share information and talk to your friends, and always relay anything new that you discover, because learning is powerful. And once again, I just want to say that we are both not licensed professionals or experts on this topic, but we're sharing our personal experiences and stories in hopes that this information can help someone.
And I would also say, if our listeners have heard something here or have something that they want to share, you can feel free to email us at womenknowhowpod@gmail.com. We'd love to hear your thoughts, or leave us a message at one of the podcast sites. We'd love to hear your thoughts, because this way we'll help build our community of sharing ideas and best practices. And again, with knowledge is power, and with power we can advocate. So absolutely. That is a wrap for our show today. We will see you next time on Women Know How. Be sure to subscribe to Women Know How on YouTube and Spotify, and follow us on Facebook and Instagram at Women Know How Pod. We'll see you next time.
And make today great and tomorrow even better.
We'll see you next time. Bye-bye.